My name is Julia Jenkins. I work for the Every Life Foundation for Rare Diseases, and part of my job there is to run rare disease legislative advocates. So I am here. I'm here to hopefully compel you to take action in the political process. I know all of you here are either work for patient organizations or are a parent advocate or a patient advocate, whether that be fundraising for your disease or just trying to get your child care. Another really important aspect that, well, at least to me, is the political process. And there is a very key role that patient advocates must play. So this storm was not from last weekend, but there was actually a nice lightning and thunderstorm when I was in DC last week. So I do love this picture. You can take the government as the problem, or you can take it as the solution. Sometimes it is both, but it is more likely to be a solution when the patient advocates speak out. So I spoke to you all last year here, and I was talking about the big success that we had. We passed some great legislation, and now it's time to continue to fight. Unfortunately, once you pass legislation, you have to get it implemented. So that is what we are working to currently do. This was the threats to the development of rare disease treatments was the caucus briefing that we hosted last week actually. And we are currently concerned that FDASIA is not being implemented for rare diseases. But luckily today I've got some good news. We actually had 100 members of Congress sign on to a letter asking the FDA to fully implement FDASIA for rare diseases, and that is because of people like you and some of you in the room. Tracy definitely helped get a good number of those members to sign on. Getting members to sign on is only possible when they hear from their constituents. So thank you for all of you that took action. Our intern Annie back there, she definitely helped get a lot of those members on board as well. But there are a lot of other threats to the development of treatment. There's tax reform that's going to happen, potentially going to happen. And it threatens the orphan drug tax credit, could be eliminated. That's an essential part of the Orphan Drug Act. We have sequestration cuts affecting the NIH and FDA. There's a little bit of legislation to help the FDA that we obviously encourage the patient community to weigh in on. There's also some issues that you guys are probably aware of, but there's some issues with the FDA about very complicated toxicology. You'll learn a little bit more about the drug development process later today. But clinical trials are being offshored, and U.S. patients don't have access. So this is going to be an issue that we are going to start working to press Congress on. And it's an issue it's a difficult issue because it's about safety and toxicology. And so we, as the patient community, have to educate Congress, because this is not something that industry is going to be able to speak on our behalf. It has to be patients asking Congress to make this change. I know it said that I was going to give a healthcare reform update. I only have 10 minutes. There's no possible way to give a healthcare reform update in 10 minutes. So I'm just going to put it out there that there are going to be issues that are going to be arising about healthcare reform implementation. It's going to be stuff where you can act locally at the state level. So I encourage you all to get involved at the state level. And I know Global Genes is really great at sharing RDLA's action alerts. So look for those and take action. There's lots of issues too. I mean, we've got disability rights, if some of you guys are concerned with that. So I know there's a lot. So I'll move on. I know I've kind of scared you into the doom and gloom, but actually there's a lot that a patient advocate could do. And I just found this quote. I think that me personally, it spoke to me because it's overwhelming. Even though it's my job to take care of legislation, there's a ton of different policies that you could potentially get involved in. But this quote is, you are one, but you can still do something. So, it's really about the patients taking action, and that you really do make a difference. So why does it matter to you? Legislation and policy actually does really affect the drug development process. If we can change the way that the FDA regulates drugs, or the way, making sure the FDA is funded, making sure the NIH is funded, might cost less money to get drugs developed. So you as advocates don't need to raise as much money to get drugs developed. You'll learn, this is the big term on Capitol Hill yesterday about rare disease, the ecosystem of drug development. It's a big process, and I'm glad all of you guys are here. You're all getting educated, because that's the most important part, to understand the role that you play. So I'll say this. I have two messages. One is for the patients and one is for the patient organizations. Really, the organizations are only as strong as the grassroots make them. I work for the Every Life Foundation. We're only as strong as the people that we can motivate to take action. So you guys are really the key. It's not these big, powerful patient organizations. It's the grassroots that take action. And one of the big things, big, major patient organizations aren't necessarily going to take politically risky positions. So make sure that you know what your patient organization is working on. I encourage you to also influence the patient organizations that you work with. Tell them about the policies that you want them to get involved in. And then, of course, you want to call, email, attend a town hall. Now, some people call it lobbying Congress. It's also stalking Congress. You go to their fundraisers, you go to their town halls, you go meet them in the district. Oh, you go show up in DC. Eventually, they will, start to pay attention, because you're in their face all of the time. So I definitely encourage friendly stalking of your members of Congress. But mostly this is to build relationships, because that's the goal, is you want to be that resource for your member of Congress. You want Congress to call you when they hear about a rare disease issue, because that's your goal, is to be that connection to Congress. So many of you guys here have patient organizations, and even though you might not be involved in policy, there's still a huge role that you can play. There are a ton of sign-on letters that you can sign on to support. Your name actually does count. When a member of Congress, when they see a list, they're just counting the numbers. Your patient organization, Hannah's Hope Fund, is as important as NORD when they're looking at the list. So add your organization's name. It's really important to use your voice this way. So I also encourage you to join coalitions when you pick your priorities. I know that there's way too many issues to get involved in all of them, but pick a few. Mobilize and teach the rest of your members. And this is really about, I went to the FDA meeting last week? I was in DC, yes. And it was a bunch of people like me that work in government relations, and they're really trying to communicate to the patient community. So we really, as patient organizations, need to figure out a way to not just send our representatives to these meetings, but to send actual patients to these meetings. So I encourage you, all of you that are here today from an organization, to figure out a way to share this information with the rest of your membership, because educating the patient community is really the key to success. This is just a little bit about what we do at RDLA. So I know sometimes DC can be a scary place, but we do hold monthly calls where you can just call in and learn about all the different legislations that's happening. Again, we had like 15 different issues on our last call, so I could spend another hour and a half going over all of them. But I encourage you, if you're interested in policy, to call in and learn about the different legislation. We hold caucus briefings. We have a legislative conference and lobby day to kind of builds on this day, but just a little bit more policy focused. We do have a big week in DC during Rare Disease Week, and we are partners with Global Genes in this. We have discounted hotels. We provide travel scholarships. I do not have the dates firm, unfortunately. We are still waiting to hear if the FDA will hold a Rare Disease Day event, because we do kind of coordinate with the NIH and FDA so that we can bring advocates to DC to attend all of those events. Last year we had 150. Our goal this year is to bring 200 advocates to DC. This will be our 3rd year for our lobby day, so it's growing fast. This is one of my favorite slides. If you came to the lobby day, you probably saw it. This was what happened last year with FDASIA. There was more than 10,000 emails that were sent from our Action Center to support legislation in FDASIA, and that is really the kind of volume that you need to pass legislation. But the big thing is during the negotiations between the House and the Senate bills, there was a key piece that was missing from the Senate bill. And we actually sent out an action alert that we wanted, there's big competition. Well, if I want to fight for my provision, I want to fight for my provision. But we sent out an action alert saying we want all 5 of the rare disease provisions into this bill. 121 organizations signed on to support the bill in 24 hours. We got all 5 provisions into FDASIA. Don't thank me. That's you guys. You guys did that. So, that's what you can do when you sign on to support legislation. You can really move the ball. So, thanks for having me here today. I will be here all day if you have questions. I'll go upstairs and get my cards if you don't want to take down this information. But I'm here as a resource, and thank you all for letting me speak today.